Hello, everyone. I'm Tyler Chrestman, and welcome to the Chrestman Conversation. Today on the podcast, we are going to talk about the state of COVID here in August of 2021. And I want to be very clear right from the jump. Let me just say this. The pandemic is over, at least here in the United States. There is no reason for anyone to panic anymore, period. If you watch the news, if you consume cable news, which I do not recommend, that's not what you're hearing. What you're hearing, I saw on CNN the other day, they had a chyron at the bottom that said COVID cases are on the rise among the vaccinated. This is such misleading, ascientific nonsense. They were talking about how the Delta variant's coming and breakthrough COVID's going to get you. This is just fear-mongering at its worst. There is no reason for people to be worried when you are vaccinated, and we're going to break down why we're going to use data from the CDC to do it. So let's just jump right into that. So far, the CDC is reporting that 163 million people in the United States are vaccinated. 163 million. There have been a grand total of 6,239 breakthrough hospitalizations. Breakthrough is what they're calling it when you get sick despite being vaccinated, a breakthrough infection. Of the 6,000 hospitalizations, there have been 1,263 deaths. So, 163 million people are vaccinated, 1,000 people have died. Let's put this into perspective. This means that less than 0.004% of vaccinated people have had cases that resulted in hospitalization, and less than 0.001% of fully vaccinated people have died from COVID. Let's say that one more time. If you get vaccinated, your odds of dying from COVID are 0.001%. Less than that. That is the only way any news organization should be framing this. The only way. If they are saying that there is a risk to people who are vaccinated, they are misleading you. They are trying to scare you because being afraid sells advertisements. That's really the only reason. They want you to watch. Be afraid. Stay home. Watch the news. Be afraid. Stay home. Read our online articles because we'll tell you to stay home because we want you to read more articles. It makes no sense for anyone to be telling vaccinated Americans that they should be worried. None whatsoever. 0.001% of people who are vaccinated die. This is ridiculous. Saying vaccinated people need to get along with lockdowns or mask mandates again. No, if you're vaccinated, you don't need to wear a mask. The CDC is shooting itself in the foot. They have lost all credibility on this subject. The St. Louis County, for example, just imposed a mask mandate. I'm not wearing a mask. I'm not wearing a mask around. There's no reason to anymore. The rolling 7-day average for deaths in St. Louis County. You ready for this? 7 per week. One person a day in St. Louis County is dying from COVID in a population just shy of 1 million people. One person out of 1 million people die a day from COVID in St. Louis County. Do you know what's more deadly than COVID in St. Louis right now? Anything. Anything is more deadly than COVID right now. I'm pretty sure if I really dug into it, there would be days when bee stings have been more deadly than COVID in St. Louis County. If we really just dug into the numbers, there is no reason it's August of 2021. There is no reason. I'm going to keep saying this. No reason why we should be worried about COVID. St. Louis County imposing this mask mandate is just, again, scientifically illiterate. There is no reason. The CDC came out and said masks should be worn regardless of vaccination status. Why? They did this, again, shooting themselves in the foot. They based this on a study out of India that indicated that the Delta variant the viral load of the Delta variant is so massive that vaccinated people may potentially be able to transmit it to non-vaccinated people. That study is based on a vaccine that's not even available in the United States, and that study was rejected for peer review. And the CDC is using it as justification to say that vaccinated people in the United States should wear masks. Where is their credibility? I thought these people were supposed to be scientists. I thought they were supposed to be our medical betters who knew things. This is ridiculous that they don't understand this at this point. At this point in the United States, 60% of the country has had at least one dose of the vaccine. Okay, 60% of the entire country. Now, they don't need to worry. So you have more than half of the country. They don't need to worry about COVID. Okay, 60%. At this point, the vaccine is available to anyone. Anyone could get it. So if you weighed the options and you decided not to get it and you get COVID and die, well, that sounds like it was a bad choice you made. That's not my fault, not my responsibility to make sure you don't get COVID. It's not anyone else's responsibility to make your medical decisions. If you decided you didn't want to get COVID and your reasons are ridiculous, that's on you. It's not my fault. Saying that we need to live our lives to protect the unvaccinated at this point. The amount of people, by the way, because I know already where this argument's going to go, the amount of people who cannot get vaccinated due to immune compromised issues is very, very small. My number here might be a little off, but I believe the last time I saw the number, it was something like 100,000 people in the entire country couldn't get vaccinated because they're immunocompromised in some way or another. 100,000 people. So we're not talking about that 100,000 people, which need to live differently anyway because they have to be more concerned just in general. I'm talking about all the other people. If you can get vaccinated, you don't have a medical condition preventing you from getting vaccinated, and you choose not to, okay, that's cool. I don't care. You can do whatever you'd like. I make no judgments on people who don't get vaccinated. Do not care whatsoever if you don't want to get it. You know, it's not a celebration you don't get it. It's also not a judgment. And if you're doing one or the other, you're making a mistake. Does not matter. People are weighing the risk benefits and doing what's right for them. That's cool. That's great. Do that. But if you get COVID and die after being not vaccinated, okay, I'm also not going to feel super, super sorry. I'm just not. You made the wrong choice. It happens. It's sad. But I'm not going to live my life to protect you when you've made that choice. No one else should either. And by the way, the unvaccinated people are not the ones asking for the paternalistic care from the government. They're not the ones asking for mask mandates and lockdowns. They're the exact opposite crowd. So when we pretend that what we're doing is being compassionate to the people who are at risk, no, we're not. They don't want this. They don't want mask mandates. They don't want lockdowns. They're not asking for any of that. And you can't say, well, I know better than you, and I have to protect you from yourselves. They're not children. Some of them are children, but that's a different story. There are, for example, 163 million people are vaccinated. Why are we not having a conversation about the 34 million people who already got COVID? Are they part of that vaccinated number? Or is some of the unvaccinated, the 34 million people who have natural immunity and chose not to get vaccinated? That brings that number up more. What about the fact that 75 million people in this country are under the age of 18? They don't need to be vaccinated. People are acting as though children need to be vaccinated. We got to get them back to schools. They can't go till they're vaccinated. We got to worry about the kids. That we've known this for a year, that we don't have to worry about the kids. Anyone who talks about COVID being like afraid for their children, I hate to say it, at this point you're a fool. You don't know what you're talking about. According to the CDC, there's less than 400 kids who have died in the entirety of the pandemic from COVID. 75 million kids, 400 have died. In the same time period, 800 have died of pneumonia. The COVID doesn't affect children. We've known this from the jump. There is no reason. God, I'm going to keep coming back to the phrase. No reason to have to vaccinate kids. None. Doesn't make any sense. So why are we not including that 75 million in the thing? Does that not bring up our total a little bit? It's looking more like 2/3 when you take into account the 34 million people who have natural immunity and the 75 million kids who do not have to worry about COVID. So it's incredible to me that we're having these talks about lockdowns and mask mandates again. Lockdowns don't work. They don't work. There's no science that shows that they work, period. Does not exist. Any place in the world that locked down, all you see is a U-shaped curve of infections and death. So what happens is you lock down, you see a little bit of a drop, you open up, that you see the drop. You open up, what happens? U-shaped curve. It goes right back up. Infections and death go right back up because lockdowns do not work because the virus doesn't go away. We think that we're going to lock down. The virus just goes other places and then comes back. It does not disappear. Even if we did a national lockdown, everyone in the U.S. locked down at the same time, we all stayed home for 2 weeks, it would not matter because the world didn't do it. The world's not doing it. It's a pandemic, people. It's everywhere in the world. You think everyone in India is going to stay home at the same time everyone in the U.S. stays home and the virus is just going to go extinct on its own? It's never going to happen that way. That was never the goal. And so if the pandemic is over, which it should be, we should move on with our lives. Except it will never be over. That's what we need to realize. It is never going to be over. Pfizer just came out and announced that every 6 months you're going to need a booster shot for their vaccine because it looks like the immunity is probably going to wear off, and Pfizer's like, money. Let's go, baby. So every 6 months you're going to need a booster shot. Okay, starting to sound more like the flu, people. Every year you need a booster shot or you need a flu vaccine, a new one. Starting to sound more like the flu. Are we just going to live with COVID? What is the goal for these people? What do they want? They want zero COVID. Zero COVID is not a realistic goal. It is never going to happen. It never should have been the goal. Does anyone remember the start of the pandemic? It wasn't that long ago. Why did we all lock down? Why did we stay home? We stayed home to flatten the curve. What was the curve and why was it important? Remember the line? There was a dotted line right across the top. It was the ICU capacities of local hospitals, and the goal was to flatten the curve. The goal was not to eliminate COVID. The goal was to spread out how you were going to have, if you lived in a city, let's say I live in St. Louis. There's 1 million people here. Let's say all 1 million people of us were going to get COVID. Every one of us. Well, the goal was to take it so that instead of having this giant spike where we all get COVID at once, we were going to flatten the curve and we were going to spread out. And so instead of all of us getting COVID in 1 week, we were going to all get COVID over the course of a month. We were going to just slow the spread. That was the goal. It wasn't to eliminate COVID. It was to not overwhelm the hospitals. It was the whole goal of lockdowns. Look at your ICU capacity. Don't overwhelm your hospitals so that people who get COVID can go and get treated. That was the goal. And then it became, well, now we have to stop interacting with one another because we're going to stop COVID in its tracks. Not a realistic goal. People went along with it. Then it was, well, we're just going to stay home because we're going to wait for a vaccine. Once the vaccine gets here, we're all going to get out. We'll live our normal lives again. Okay, that was the goal. Well, the vaccine's here. And now people are vaccinated. 60% of the country vaccinated. Why are those people not out living their lives? Well, because the Delta, there's a new variant out there. And it's real contagious, people. It's dangerous. It's scary. Okay. Does it affect the vaccinated? Well, I mean, what about those 1,000 people who died? Okay. What about the other 163 million? What about those people? The goal is, if the goal is no COVID, the pandemic lasts forever. Don't be manipulated by these people. They are using data to lie to you and to misrepresent things and keep you locked in your home for some reason that these petty tyrants don't want to relinquish control. This governmental force does not want to let go of the emergency powers that they had this past year. If you're vaccinated, you're safe. If you're unvaccinated, I wish you well health. There is no reason I'm going to live my life to not infect the unvaccinated. And I do not, if you're vaccinated, you have nothing to fear from someone who's not vaccinated. You do not. Live your life. Get out of the house. Stop being afraid. Go back to normal. Mask mandates are ridiculous. If you're vaccinated, you don't need to wear a mask. You don't. There is no science that backs that. None. Even the science the CDC pointed to has been discredited already. It got rejected for peer review because it was bad. And it was based on something not even based in this country. It wasn't based on the Moderna or the Pfizer or the Johnson & Johnson. It was based on a vaccine that's only available in India. Don't listen to these people. They do not know what they're talking about. They're lying to you. It is ridiculous that they think that mask mandates and lockdown should be on the table again. Lockdown should never be on the table again, ever, period. They didn't work. They don't work. Mask mandates are fine sometimes. You know, the height of the pandemic, I said, all right, whatever. I'm not wearing a mask anymore, people. It is ridiculous to think that I'm going to put a mask on when I go to the store. If you're not vaccinated, I'm not wearing a mask for you. And if you're vaccinated, I'm not wearing a mask for you. It doesn't make any sense. It's just a minor inconvenience. That's not the point. The point is it doesn't need to happen. It's not about how big of an inconvenience it is to me. I don't like it. I'm not going to do it. It's silly. And it's not based on science. Ugh. People, it's a mess out there right now. It's silly. It doesn't make any sense why it has to be. We could all be living our normal lives right now. They're talking about the Delta ravaging Missouri. I live in St. Louis. The rolling death count, again, is 7. 7 for the week. 1 out of 1 million people a day in St. Louis County are dying from COVID. Now, I understand it's worse in other parts of the country. We didn't even get into the vaccine hesitancy thing. One of the things that drives me absolutely bonkers is that they keep framing this thing that because it's happening more in Republican states than in blue states, they keep framing it like only those dirty Trump voters aren't taking the vaccine. The largest group in the country that has vaccine, your rates of vaccine hesitancy are greater among the black population than the white population. 40% of school teachers in New York City, the epicenter of the pandemic, don't have the vaccine. It's like the idea that it's only those bad, evil Trump Republicans who are refusing the vaccine. That's not true whatsoever. So we need to stop saying that because that's just not true at all. Now, your rates among Republicans, your rate among Republicans is higher than your rate among Democrats, but there are other factors here that play in. There's a socioeconomic factor. It's your rate of vaccinations higher among your upper class than your lower class. It's higher among your white population than your black population. And then it seems evenly split among what kind of job you do. So let's stop framing it that way too. That it's only the evil Trump Republicans that aren't getting vaccinated. It's not true at all. People are smarter than we give them credit for. They are making choices about their own health and well-being, and we need to let them do it. Quit trying to bully people into getting a vaccine. You don't need to mandate anything. Anyone who's trying to force people, and let me just frame this in any way a good lefty might appreciate. My body, my choice. How about that? What happened to that? You don't get the right to tell someone what to do with their body. I thought that was a pretty liberal position, yet I'm seeing a lot of progressives who are very much about mandating what someone does with their body. That seems a little hypocritical to me. Just throwing it out there. Anyway, we're going to leave it there for the day. I'm Tyler Chrestman. As always, people, I appreciate the listens. You know what's weird? The podcast got randomly spiked on Spotify. So a bunch of people started listening on Spotify all of a sudden, which was really cool. I appreciate all the people who switched over. Maybe it's just people switching to that platform. But I appreciated all the Spotify listeners out there that are now getting the Chrestman conversation. As always, we're available everywhere on the Facebook and YouTube, Apple, Spotify. You can download it straight from my website if you are one of those kind of people. I think you probably put it in your iTunes if you still have an old version on your on your laptop. Don't forget to like, comment, share, leave a review, do all the good stuff to help promote the podcast. I really do appreciate it, people. It's really fun coming up here, talking to you, and reading a lot of the comments I get on both the website and the YouTube and Facebook pages. It's really fun. So, as always, I appreciate you. Hope you guys have a good day, and I will catch you on the next episode.